Good to have you on the show today. Now, we're talking about something today called degenerative disc disease, and obviously this could cause a bit of pain and discomfort. The patient probably doesn't know what's going on, they just know their back hurts. You brought along a rather dramatic display of this, but let's talk a bit about that. That's a common lower back condition, I understand.
It's probably one of the most common reasons for lower back pain, especially in the senior population. And we see quite a bit of that in our practice.
All right. Do we know what causes it?
The cause of degenerative disc disease is pretty much chronic wear and tear. The analogy I use is the brake pads and the tires on your car. The longer you drive the car, the more wear and tear you're going to have. So a lot of it is age-related, although traumatic injury can accelerate that process. But for the most part, chronic usage of the discs and the wear and tear leads to a gradual decline in the water content of the disc, which makes it very brittle.
Would the symptoms be similar to just a backache, or would they be more intense? How would someone, without medical examination, really know that's what they had?
Typically, the pain in the back is just localized to the back. However, depending on the extent of the degeneration and the narrowing it causes in the spinal canal, or any compression it may cause on the nerve roots, patients may also have pain that radiates into their legs. They may have more pain with just sitting or standing, depending on which structures are affected the most.
You brought along a rather dramatic model that shows us the progression of this condition. Maybe you can show us a little of what we're talking about as this disease would be a function of the aging process, among other things.
Sure, if I can show you that from this side, this is a textbook normal disc, and you can see how the vertebral bodies are separated very nicely with this.
This is the hard bone
disc.
part.
So this is the hard bony structure. What's in between is the intervertebral disc, which is the shock absorber, if you will. And as we move to the other side, you can see that the disc, as it loses water, becomes more and more brittle. And this is a very significantly degenerated disc at the very end. And you can see that there's really not much disc space left. And if I turn this to the side, you will see that the nerves don't have as much room to exit. As a result, the nerve can be irritated and inflamed, and patients can experience pain down their legs. Also, we have joints in the back, if I turn this around, and you can see how these joints in the back will start to become very arthritic. These are called facet joints, and a condition called facet syndrome develops, which leads to a lot of back pain upon standing in one place or walking.
Something that maybe folks can't notice from the model on TV, but if you look at the edges here of the hard part, the bony part, they're fairly smooth. As we get over here, they're starting to rub against each other, and there's some roughness. So by the time you get to this one, it's almost bone on bone.
The roughness that you're referring to, Rob, is what we call bone spurs.
Okay.
So when people are told that they have a lot of bone spurs in their back, that's the roughness that you see along the edges here.
And that's because that shock absorber isn't there, and these two pieces are actually touching and rubbing?
That is correct.
Okay.
So anytime bone rubs against bone, or anytime there are excessive calcium deposits, you develop these bone spurs. And those are the ones that actually irritate the nerve roots the most.
All right. Well, we know what it is. We know what the inside of our body, our back would look like if this was happening. What's the treatment? And obviously you, I think, start with a conservative treatment and work up. So how would you start out with somebody on this?
The treatment for degenerative disc disease is mostly for symptomatic relief. There is really no cure for degeneration of the discs. What happens is we try to alleviate the symptoms, reduce the pain, and increase functionality. The first step is usually anti-inflammatory medications. As I mentioned earlier, the effect of degenerative disc disease on nerve roots or surrounding structures is an inflammatory effect. So by reducing the inflammation, a lot of times symptoms will be a lot better. So starting with a very conservative approach with over-the-counter anti-inflammatory medications, moving on to prescription strength anti-inflammatory medications is usually the first step. Physical therapy, strengthening exercises, things of that nature also help take some of the pressure from the discs and from the structures and unload the spine. If that is ineffective, then other medications such as very strong anti-inflammatory medications that are injectables, that are injected directly into the spinal canal can also be very helpful. Ultimately, If things don't get better, surgery is one option. It's not the best option, but it is an option that we use as a last resort. And that's mainly when the disc is so far gone that you have to remove it and replace it with either bone graft, or nowadays there's artificial discs that are available.
So you'd replace the bone part, or you'd replace the shock absorber part?
The shock absorber part, which is the intervertebral disc, will be replaced. The area will be filled with bone graft, and the area will then be fused. So that level will be fused.
So we hear of spinal fusion, is that what that is?
That's exactly what it is. Now we have access to the latest technology, and artificial discs are available. Disc replacement is now being done where the degenerated disc is removed and an artificial disc, which is of the exact normal thickness, is replaced, thereby bringing the height back.
You'd get back to this size then?
That's correct.
What you started out with in your 20s.
That's correct.
All right.
And one of the reasons we lose height with age is degenerative disc disease, not so much losing the bony part, although you can have compression fractures that cause some curvature to the spine, but by and large, the height that we lose through aging is because of the degeneration of the discs.
And if you go to your doctor on a fairly regular basis and they say, how tall are you, and you tell them what you maybe were in your 20s, you're not going to be that tall anymore.
That is
For
correct.
almost all of us. Anybody over 60, I'm sure, has experienced that to some extent already.
And degenerative disc disease is the reason behind it.
Sure, sure. All right. Some good information, and obviously lots of ways you can help. So the first thing is, if somebody has a problem in this area, need to get a good diagnosis, and that's where your department comes in. And then once it's been determined, you start off with the more conservative approach, ending up with surgery only if absolutely necessary. So
that is correct.
Good approaches there. Dr. Gerayli, thanks for joining us on the program today. Some good information. Again, if you are having that lower back pain, this may be the cause. Give their office a call. Find out more how they can help you over there at Spinal Pain Specialists. Thanks for joining us on the show today.
Thanks for having me again.
See you back in a couple of weeks.
Thank you.
We'll be coming back with more guests and more good information for you right after this.